Have you ever gone to the dentist thinking, oh, it's just a small cavity, it won't be a big deal, and then a few weeks later, you end up with a $1,000 bill? It happens all the time. Small dental issues often snowball into bigger, more expensive problems. Most of the time, it is preventable. In this video, we're going to cover why minor dental problems get worse if ignored, how decay, gum disease, and bite issues escalate, simple steps you can take early to avoid expensive treatments, and tips for kids, teens, and adults to keep small issues small, how dentists actually think about early prevention and early intervention, and by the end, you'll understand why that little cavity matters now, not later, and how you can stop the snowball before it becomes a mountain of bills. So grab a cup of water because we're about to break down how small dental issues grow and how to stay ahead of them. Most dental issues start small, often invisible to the naked eye. Think about it. Tiny cavity. You feel nothing, maybe a little sensitivity to cold, and then a few months pass, decay spreads underneath the enamel. And that's when pain starts. Now the nerve might be involved, requiring a root canal. A tooth crown or extraction could be needed and costs just keep rising. It's not just cavities. There's gum irritation, gingivitis, periodontitis, and implants. Cracked teeth or enamel chips, worsening fracture, root canal, then crown. The key takeaway, small issues rarely stay small if unchecked, and early detection can save both teeth and money. So why do minor problems often go unnoticed until they're expensive? No pain, no problem mindset. How many small issues are painless at first? People delay checkups thinking it doesn't hurt yet. Number 2, busy schedules. Work, school, and life get in the way of preventive visits. I'll go next month often turns into months or years. Number 3 is fear and anxiety. Avoidance due to dental anxiety makes small problems grow unnoticed. Number 4 is misunderstanding prevention. People brush, floss, and rinse and assume that that's enough, but plaque and tartar can hide in areas that you can't reach. These behaviors explain why a $100 filling can then turn into a $1,500 procedure if it's left unchecked. Dentists don't just fix teeth, they predict problems before they start. Here's what they look for during a routine checkup. Number 1 is early decay. Tiny lesions that aren't visible to the naked eye. These can often be reversed with fluoride, sealants, or minimal intervention. Number 2 is gum health. Redness, swelling, or bleeding. Early gingivitis is reversible. Advanced periodontitis is expensive to treat. Bite and wear pattern. Uneven bite or grinding can cause fractures or accelerated decay. Early bite adjustments prevent complex procedures. And number 4 is oral hygiene gaps. Cavities often start where plaque is the hardest to remove. Dentists guide patients to address these spots before decay spreads, and the philosophy is simple. Catch small problems early and you prevent big bills later. At this point, you understand that small dental issues rarely fix themselves. Ignoring minor problems is one of the main reasons dental bills escalate. Dentists focus on early detection to prevent bigger complications. And next, we'll cover real-life examples of small problems moving to big bills, cost comparisons of preventive versus reactive care, and how to recognize early warning signs at home. Tips for kids, teens, and adults to catch problems early. Let's make this real, because when we say small problems turn into big bills, that's not just a phrase. It happens every single day. Example number 1, the tiny cavity. Month 0, small cavity in between the teeth. There's no pain and it could be fixed with a simple filling. Cost range is relatively low. Month 6 to 12, decay spreads deeper into the dentin. Sensitivity begins and now the filling is larger. It's more complex. Month 18 plus, infection reaches the nerve of the tooth. Now there's severe pain. The root canal and crown is required, and now the cost has multiplied significantly. Same tooth, same original cavity, completely different bill. And here's the important point. cavities don't shrink, they spread. They don't heal on their own, they only grow. One tooth turns into 2 teeth, turns into 3 teeth. Example number 2 is bleeding gums. Stage 1 is slight bleeding, mild inflammation, diagnosed as gingivitis. The treatment is a professional cleaning and improved hygiene. Number 2, uncontrolled plaque buildup. Gums are pulling away from the teeth and we're seeing early signs of bone loss. Now we're looking at deeper cleanings. Stage 3, advanced gum disease. Possibly loose teeth. Maybe some will not be able to be saved. We're looking at implants and bone grafts. What started as I just don't floss enough turns into a very expensive scenario. Example number 3, the small crack. You bite something hard, you feel a quick zing, it goes away, you ignore it. Over time, the crack deepens. Bacteria enters and the tooth weakens. Eventually, there's a sudden fracture. Severe pain or an emergency appointment may be necessary. Root canal or extraction. Early intervention could have meant a simple bonding or a crown. Waiting often means emergency care. Now let's talk numbers. Not exact pricing because that varies, but conceptually. Preventive care includes routine exams, x-rays, cleanings, fluorides, sealants, early small fillings. These are predictable and manageable. Reactive care includes root canals, crowns, implants, extractions, bone grafts, and emergency visits. These are complex, time-consuming, and significantly more expensive. Prevention is maintenance, reaction is repair, and repairs often cost more than maintenance. Think of it like your car. Oil changes are inexpensive. Ignoring an oil change leads to engine replacement. Teeth work the same way. Here's where you gain the power, because if you can recognize early signs, you can stop the escalation. Sensitivity. Mild sensitivity to cold drinks, sweet foods, air exposure could be early decay, enamel wear, gum recession. Don't ignore it. Bleeding gums. If your gums bleed, that's not normal. It's inflammation. It's the first stage of gum disease. Healthy gums do not bleed. Getting the food stuck frequently. If food constantly traps in the same area, there may be early decay. A failing filling or gum recession, that's a red flag. Jaw pain or headaches. This could signal grinding, bite imbalance, early fracture. Addressing it early prevents cracked teeth later. Bad breath that just won't go away. Chronic bad breath may indicate gum infection, decay, bacterial buildup below the gum line. Masking it with mouthwash doesn't fix it. Children are where prevention has the biggest impact. Small cavities in baby teeth can spread quickly, cause pain, affect speech, and affect permanent tooth development, lead to early tooth loss, and when baby teeth are lost too early, the teeth shift. Crowding can increase and orthodontic costs rise. Sealants, fluoride, early orthodontic monitoring are all preventive investments. Catching small issues early in kids prevents major issues later. I can't stress how important this is. So far, let's recap. We've covered real examples, the financial difference between prevention and repair, early warning signs that you can recognize, and why prevention in kids is critical. But now we're going to talk about the psychological cycle of delay. Why "I'll wait" is the most expensive phrase in dentistry. How to build a simple prevention system and practical habits that keep small problems small. Let's talk honestly. Most big dental bills don't happen because people don't care. They happen because of delay. And delay usually sounds like this. It doesn't hurt yet. I'll schedule it next month. I'm too busy right now. I'll wait until the insurance resets. It's probably nothing, but here's the reality. Dental problems don't pause while you're busy. They progress silently. Tooth decay spreads, gum inflammation deepens, cracks widen, and bone loss continues. And because early stages are often painless, the brain interprets silence as safety. But in dentistry, silence doesn't mean healthy, it means early. By the time pain shows up, the problem is usually advanced. Pain is the late warning sign. Let's expand this beyond dollars. Waiting costs more than money. It costs time in the dental chair, more appointments, more anesthesia, more recovery time, more stress and anxiety, and sometimes even lost days at work. A small filling may have just taken 30 to 45 minutes. A root canal and crown, multiple appointments. temporary restorations, follow-ups, an implant, months of healing, and the longer you wait, the more complex the treatment becomes. And complexity always increases cost, financially and emotionally. Now, if you find yourself in this position, we're here for you. But because awareness without action doesn't help, here's how to build a simple system that keeps small problems small. Keep regular checkups, even when nothing hurts. This is non-negotiable. Routine exams allow dentists to catch microcavities, early gum inflammation, failing fillings, bite wear patterns. Catching something early often means smaller treatment, lower cost, a faster appointment. Think of it as routine maintenance, not optional care. Upgrade your daily hygiene slightly, not perfectly. You don't need perfection. You just need consistency. Focus on brushing twice a day with a fluoride toothpaste is what I recommend. Flossing once a day, especially where food gets stuck. Replacing your toothbrush heads regularly. Using a water flosser if traditional flossing is difficult. Small daily habits prevent large restorative procedures. And don't ignore sensitivity. If you notice cold sensitivity, sweets causing discomfort, pain when you're biting, schedule an evaluation early. Early enamel erosion or small cavities are manageable. Waiting means nerve involvement. Protect your teeth from grinding. If you wake up with jaw soreness, headaches, worn teeth, you may be grinding. A night guard is far less expensive than replacing fractured teeth, multiple crowns, full mouth reconstruction. Prevention here is powerful. Address gum health early. Bleeding gums, inflammation, deep cleanings recommended. Don't postpone. Gum disease becomes dramatically more expensive and complicated as it advances. And unlike cavities, gum disease affects the bone, which doesn't grow back. For parents, this is critical. Prevention in childhood affects adulthood costs. Here's what matters most. Early dental visits, sealants on permanent molars and premolars, monitoring spacing and crowding, encouraging nasal breathing, teaching proper technique early for toothbrushing, and small orthodontic evaluations early can prevent complex treatments later. Prevention compounds over time. So now we've covered why delay is expensive, the emotional and time cost of waiting, clear prevention systems, family strategies for long-term savings. In the final section, we will bring everything together. Clear signs that you should act now, a simple decision framework, how to avoid dental regret, and the mindset shift that protects your smile long-term. Let's make this very clear. There are certain signs you should never wait and see with. If you're experiencing tooth pain that wakes you up at night, swelling in your gums or your face, a cracked or broken tooth, bleeding gums that persist, pus or a bad taste near a tooth, sudden sensitivity that doesn't go away. That's not a monitor it situation. That's an act now situation. Why? Because infections in the mouth don't stay in the mouth. Untreated dental infections can spread to surrounding tissue and, in rare cases, beyond that. The earlier you treat something, the simpler it is. Once infection sets in, complexity rises quickly. If you're unsure whether to address something now or later, use this rule. Ask yourself, 1, is this improving on its own? Dental issues almost never do. Number 2, would it likely be cheaper to fix this early? Yes, in nearly all cases. Number 3, if this worsens, will treatment become more invasive? Almost always. If the answer to those questions points toward early action, that's your sign. Waiting rarely simplifies dentistry. It almost always complicates it. Here's the real shift that changes everything. Stop thinking of dental care as something that you can do when it breaks. Start thinking of it like maintenance. You don't wait for your roof to collapse before checking it. You don't wait for your car engine to fail before changing oil. Teeth are no different. Maintenance is predictable. Breakdowns are expensive. And here's something powerful. When you stay on top of small issues, dentistry becomes routine, not dramatic. No emergencies, no surprises, no huge bills. Just steady maintenance. That's the goal. Let's bring this full circle. Small dental problems turn into big bills for 3 reasons. They don't heal themselves, they're painless early, and people delay until discomfort forces action. That's it. Not bad luck, not unfair pricing, not random events. It's biology. Decay spreads. Inflammation progresses. Cracks deepen. Bone loss advances, and biology doesn't pause. But the good news? You can interrupt that process early. Here's what I want you to remember. Small cavities become root canals. Mild gingivitis can become tooth loss. Tiny cracks can become broken teeth, and sensitivity can turn into infection. Delay becomes expensive. Early exams prevent escalation. Cleanings prevent surgery. Night guards prevent fractures, and dentistry is one of the few areas of healthcare where early action dramatically changes the outcome. And the earlier you act, the more control you have. If this video helped you understand why small dental problems turn into big bills and how to stop that from happening, share it with someone who you know keeps saying, "I'll go later." Later is usually more expensive. If you haven't had a checkup in a while, consider this your reminder. Not because something is wrong, but because prevention is powerful. Take care of small things while they're still small. Your future self and your wallet will thank you. Thanks for watching, and remember, healthy smiles aren't built in emergencies. They're built in maintenance.